everyone, I'm Jacqueline from Emerge Pediatric Therapy, and today I'm here to talk to you about gastrointestinal concerns or stomach concerns that may be impacting feeding and regulation for our kids. This topic is really important for us to discuss today because whenever there is something that's uncomfortable in our bodies or just not feeling quite right, it's really hard for us to make progress or to learn new things. Think about any time that your body has been feeling uncomfortable or you've had something going on in your stomach or a headache. It's really hard for you to pay attention to things and to be able to take in new information from your environment. And it's the same thing for our kids. If there's something that's not feeling right in their bellies, then it's going to be really hard for them to get to that place of regulation, to be able to manage all of those different types of sensory input, or for them to be able to try out new things or to learn how to do something new. So what are some ways that kids let us know that they are having some of these GI concerns, or what we call our red flags? So from a feeding perspective, kids that are having stomach concerns may do what we call grazing, where they're eating a little bit here and there and then sort of moving around the room or engaging in other activities, or they may limit how much food they're eating at each meal. We may see some signs like gagging to food, sometimes even vomiting, or what we call retching when they're trying to eat food or when they're in the presence of food. Children with stomach concerns may have poor appetite or inconsistent intake. They may eat more at certain times of the day or more on one day versus another day. They may have a lot of crying or irritability with meals. Sometimes these children will skip meals altogether just because their bodies are so uncomfortable, or we'll see a lot of avoidance of certain food groups altogether, or extreme picky eating. In fact, for a lot of kids that have underlying reflux, we see a preference for what we call more of our carbohydrates or our starchy, carb-heavy foods. Foods like our fruits, especially our more citrus fruits or acidic fruits and vegetables, can really aggravate that reflux more. So the kids tend to favor the carbohydrates because they're going to be really easy on their stomach. So our goal as therapists at Emerge is to treat these underlying medical concerns first. And for us, since we are not doctors, that means checking in with our families and then checking in with the doctors too, to let them know the signs that we're seeing. When feeding concerns like avoidance of certain food groups or having a lot of difficulty with picky eating have been going on for a really long time, sometimes these stomach or GI concerns can be really hidden. The kids have learned adaptive strategies. They've learned when to eat, when not to eat, so that their bodies feel right. It can be harder to pick up on if they have reflux or constipation concerns. So I'm going to dive in a little bit deeper about two of our most common GI concerns, constipation and reflux, or gastroesophageal reflux, what we call GERD, to help you notice some of these signs and symptoms a little bit more easily. The first GI concern that I'm going to talk to you about is constipation. This is one that people are often a little bit more familiar with because a lot of us have experienced this at some point throughout our lives. So constipation is when it's really hard for us to go to the bathroom to poop. It might be hard to push things out. Things might feel like they're getting stuck, or there might be some blockage. It might take us even a day or more to be able to use the bathroom when we feel blocked up. Constipation is actually one of the top causes of abdominal pain. So when we see kids pulling on their stomach, pressing, holding, we really want to check in to make sure how often they're going to the bathroom or how long it's been since they have been to the bathroom. So our goal for toileting is for children to be able to pass 1 to 2 larger stools a day without any pain, without extended pushing, straining, anything like that. So how does constipation impact eating? Constipation can cause a feeling of fullness just in our abdomen, which can make our kids a lot less likely to eat. Think about if your stomach's feeling really full because you haven't used the bathroom in a while. You're not going to be hungry to accept more food into your body. It can also cause nausea or some discomfort in our belly area, and this has actually been linked to some poor weight gain as well. So when things are blocked up inside of our bodies, again, we're not taking in a lot of new food, which can cause some difficulties with that weight gain. In addition to our nausea, we can also have some cramps, some gas, and just some of that overall abdominal pain. One of the biggest concerns with constipation is that it leads to an inability to attend to other activities. If your body is feeling really uncomfortable, you're not going to be able to engage in meal times with your family and have those back and forth, conversations or gestures. And outside of feeding, it's going to be really hard for our kids to engage in play activities, to learn how to do their letters or to sit and attend to some of our emotional regulation curriculums, anything like that, because they're going to be so concerned with what's going on in their bellies. Especially for our kids who are nonverbal, we really need to be checking in with what's going on inside of their bodies, because it's harder for them to communicate to us if they're just having some pain or discomfort in their belly areas. So some things to look out for as a parent are: how often is your child going to the bathroom? We want our kids to be using the bathroom 1 to 2 times a day to go number 2. And what does that poop look like? Is it really hard? Is it hard for them to pass? Is it coming out in small little chunks or pebbles, meaning that they're having trouble passing the entire solid stool? Or on the flip side, is it something that's really soft, that's coming out a little bit too often? Is your child having any pain? Are they having to do a lot of straining and pushing for an extended period of time to be able to pass that bowel movement? Are they eating better after they poop? This can be a big sign that they're feeling too full or having more of that constipation if they're just, eating these bigger meals or having a larger appetite after they're finally pushing out that bowel movement. We also want to check in to see what your child's fluid intake or fiber intake looks like. If your child's not drinking a lot of water during the day, it may be a lot harder for them to be able to push out these bowel movements, and the same thing with fiber intake. Fiber really helps our bodies to be able to get things out and to get things moving. Also, just taking a look at some other underlying things that may impact our ability to use the bathroom. Muscle tone is a really big one. If we don't have that muscle tone and strength in our abdominal area, it is really hard to be able to have the strength and coordination to push out bowel movements. So our children that have lower tone or some difficulties with postural support may need some extra supports to be able to use the bathroom consistently. So next we are going to dive into some natural ways to treat constipation. So our first one, as we just mentioned, is to increase that water or fiber intake. This will help to get things moving inside of the body. For our younger children, our infants and babies, sometimes changing up the formula can be really helpful with constipation. Check in with your doctor or a nutritionist before moving on with this, but that can really help to manage some of that constipation. Probiotics can often be really helpful in improving constipation, but please again check in with your doctor before starting these. And at home, you can also do some tummy massage or warm baths to help reduce some of that abdominal pain and help to relax those muscles to be able to use the bathroom. The next concern that I want to go over is reflux. And reflux looks a lot different in our kids that are younger than in some of our older children or adults. So the classic symptoms of pediatric reflux are regurgitation, or that spitting up of food. This is really different from older children or adults, where our primary symptom is that heartburn or discomfort that we feel more up here when things are coming up. For our really young children, we may also see failure to thrive and poor weight gain as common symptoms of reflux. In our infants, we may see a lot of crying and irritability around meal times, some arching of their backs, refusing feedings, or even some gagging and choking. I'm going to break down some of the symptoms of reflux a little bit more based on the areas of our body. So when we think about our gastric system, everything is connected from our throats where the food is going in, all the way down through our bellies and intestinal tracts. Everything is one large tract. So we may see different symptoms at different areas of that coincide with reflux. We are going to start with this first section here, right in our mouth area. And so in this area, we may notice signs that our children are having bad breath pretty often, can be a clinical sign of reflux. We may also see a lot of gagging, sensitivity to things going near the mouth. And one that is not commonly associated or picked up as being associated with reflux is our children that have chronic sinus issues, are having a lot of ear infections. When things are coming back up and traveling into these other areas of our face and our sinuses, it can lead to some more of those infections both in the ears and in the sinuses. So if your child is having chronic ear or sinus infections along with some of these other symptoms, it may be helpful to check in with your pediatrician. Something else that we might notice along with the bad breath are some dental problems or erosion in the teeth. When all of that acid and fluid is coming back up with the reflux, it can break down different things in our mouths and especially on our teeth. We may notice some lip smacking, chewing or swallowing outside of meals. If things are again coming back up, we may see our kids really moving things around in their mouths. We may see a lot of increased drooling or salivation. So to compensate for all of that acid that's coming back up, our bodies are naturally going to produce some more of that spit or saliva to help neutralize that, again, to prevent some of that breakdown from our teeth. So for some of our kids, we may see a lot more of that drool coming back out, or see a lot more fluid in their mouths. At nighttime, we may hear some more snoring or mouth breathing. And then one thing that's really big that lets us know something might be more reflux related than just sensory related is if our children are just gagging when something is placed into their mouths. Going down into the throat area, some signs that your child might have reflux, or if they're feeling like there's a lump in their throat, if they have a really hard gulping swallow. If you're hearing your child swallow pretty often, it likely means that they're swallowing against some kind of resistance. So there's something else coming up to meet them when they're trying to swallow, which is the acid and things coming up from the stomach. So we want to be really mindful if we can hear that to look out for some of these other signs of reflux as well. As a side effect of the regurgitation or things coming up, our children might do a lot of throat clearing. They may have more hoarse voices, or they may suffer from that laryngitis or loss of their voice more often than other children. When the reflux is a little bit more severe or has been going on for a longer time, we may see some concerns happening in our lungs as well. So some things that might come about as a side effect of this reflux might be some chronic bronchitis, a lot of congestion in the chest, even leading to some pneumonia or asthma from things passing down through that area. Down in the stomach, we may see some recurrent vomiting, either during or after meals. We may see, again, what we call that regurgitation or spitting up of food, and even some spitting of clear mucus, again, to try to neutralize that acid that's coming up. Our children that have chronic reflux, again, may have some failure to thrive, difficulties with nutrition, and they may have difficulties with weight, whether being underweight or overweight. As we talked about before, children that are having some of these stomach concerns may have a preference for certain types of foods, and our carb-heavy, starchy foods aren't always the best for managing those weight levels. So we may also see some of our children with reflux actually being overweight, just based on their preference for foods to try to compensate for that reflux. From a developmental perspective, reflux can have a big impact on developmental milestones. For our infants and babies that are suffering from reflux, it makes them a lot less likely to be on their stomachs or do tummy time, because when you're having a lot of discomfort in your stomach, you don't want to be in a position that's really going to be pressing on your stomach even more. So we may see a lot of resistance to this position, which can impact a lot of our milestones, like being able to sit up, roll over, do a lot of those things that require that really postural support from the stomach area, and the development of what we call being able to extend our bodies, that we learn when we're pushing up in tummy time. As a side effect of reflux, we also might see the development of torticollis, which is an abnormal positioning of the head, a preference for one side, where one side of our neck gets a little bit more tight. We also may see some development of flattening on one side of the head as well, because our children are spending a lot more time on their backs to compensate for that pain and discomfort in the stomach area, and they may need to position more to one side to prevent more of that acid or reflux from coming up. Reflux can also lead to a delayed transition to solid foods for our babies and toddlers, and it can lead to some immature oral patterns when they're developing their ability to chew. Reflux is also associated with sleep disturbances. Our children may have reflux that gets worse overnight when we're laying in that flat position. Things can travel up a lot more easily, so we might see a lot more coughing, irritability, waking up in the night. And this can also be associated with times of day that our children have more of a preference for eating. So our kids with reflux are not going to want to eat as much in the morning. As we just talked about, when they're laying flat, things are traveling up a lot more easily. And so they're waking up with a lot of discomfort, both in their throat area and their bellies. So we may see refusal of breakfast or a denial of food in the morning. Our children with reflux may have a strong preference for water or drinking liquids. So if your child is really refusing a lot of foods going near their mouth, or refusing a spoon going near their mouth, try putting just a little bit of cold water on a spoon and see if they will accept that. Our children that are having purely reflux concerns and not as much of our sensory concerns will usually accept the spoonful of cold water, because it is not associated with that food that is going to upset their bellies. Our children that are just really oral defensive or having a lot of just purely sensory concerns are still going to likely refuse that spoon that is going near their mouths. And one thing that's important to note with reflux is that the symptoms tend to fluctuate or wax and wane. So they may get worse with illness, as we talked about some of those chronic sinus issues. They may be associated with more of an uptick in their reflux. Our reflux symptoms can tend to get worse with stress or with poor diet and nutrition as well. If you are concerned at all that your child is suffering from constipation or reflux, or just kind of confused about, or noticing some of the signs that we were seeing today and not sure if your child is having some stomach issues, please reach out to your therapist here at Emerge, and more importantly, please reach out to your pediatrician. The doctors are the ones that are really going to be able to diagnose these reflux or constipation concerns and can help connect you with the treatments that are going to be right for you and your family, whether those are natural things you guys can try at home, or whether the reflux or constipation is more severe and requiring some more medical support. And please remember to just check in with how your child is using the bathroom, and their responses around meal times and their sleeping and eating patterns. You guys are the best advocates for your children, and sometimes they need that extra voice to really figure out what's going on in their bodies. Thank you so much for tuning into our video today. We hope this content was helpful for you, and we hope that all of our families have a safe and wonderful Thanksgiving holiday. We know our celebrations might be a little bit different this year, but we are so thankful and grateful for our entire Emerge community and all of the families that we are able to support.